Good afternoon, ladies and gentlemen. This is Dr. Sascha Jovanovic here from the Guide Dental Center in Los Angeles. We are this afternoon together with one of our patients who came from us from International, who unfortunately had 10 years ago quite a dramatic vehicle accident and lost in that accident her anterior maxilla, and 5 teeth were shattered, and including the teeth came out part of her bone and part of her soft tissue. Patient was referred to evaluate her condition, and she was deemed as a patient healthy. She's not taking any medications, no social smoking, very clean patient. Her periodontal condition is excellent, and we deemed her to be a good candidate for like an anterior vertical and horizontal ridge augmentation. I'll present you the case and then our treatment steps. Here's the presentation. You'll notice that the patient has an anterior maxillary significant deficiency, and previous bone graft was already attempted on her. She actually has in the jaw a few also screws that we'll have to remove. But our goal will be is to present her a solution which will go from the 5 missing teeth to have a vertical and a horizontal ridge augmentation. And we're going to do the ridge augmentation today with a GBR titanium mesh custom 3D designed microperforated version. And this comes from Re-Oss or Y-Ox, and it's called today either microperforated, semi-occlusive, or fully protect, all the same. And then we're going to mix this with autogenous bone, which we're going to be harvesting from the lower jaw, probably the right lower ramus, with an addition of some bone space expanders, xenograft. And we're going to use a growth factor, BMP-2, which we have researched over the years, and which is excellent to, again, give us more potential for growth factors to regenerate the bone as safe as possible for the patient. Here you can see the CBCT and also her jaw relationship. You can see she's in a good occlusal position, and we're really mainly missing the anterior maxilla and, of course, in vertical and horizontal direction. You can see also in the CT scan the screws which are in position. Here the CT scan from an occlusal standpoint and from a sagittal standpoint. Notice particularly how little bone she has left in this particular position, and obviously this will be like a large bone augmentation. Rest of the teeth are in really sound and healthy condition, so that will be really good for her. And you can see the screws that have been used in the past. Here a traditional oral scan that we took to have an information and also to be used in our smile design that we did for the patient, so we knew where her future optimal gingival margin will be and her future optimal incisive edge will be. This was the tie mesh which was designed by the team in Germany, and I worked with the team to optimize the dimensions of the mesh. The mesh in the horizontal dimension is about 8 to 10 millimeters. And in vertical, we have tried to match her gingival margin, and the mesh basically goes to as close as 3 millimeters to the optimal gingival margin, which you see on the right-hand side. This is the mesh when it came back, 3D printed, microperforated titanium mesh. It comes unsterilized, so we have to sterilize it. And you can see here the nice buccal dimension that we have created in the digital design. You can see also the microperforations, and you can see the openings which we're going to be using for the screw. Here all the materials we're going to be using today. So we have the titanium mesh. Then we have the scrapers, which we're going to use to harvest the autogenous bone. We have the xenograft to add to the autogenous bone. We have the BMP-2 as an important vehicle today to enhance this very severely deficient anterior maxilla. And we have bone tacks from the MC Bio company, as well as the Profix from the Osteogenics company, to fixate the the titanium mesh. And here we're going to start and move to the case. Okay, ready? So. Okay, you can see here quite well the, first of all, periodontal probe. I'm using my U3D surgical instrument kit, and you can see like really a nice thick gingival margin. Also the keratinized gingiva on the anterior is really good. And my flap design will go from 2 teeth to the side to probably on this side 1 tooth. So we're going to go to the canine, and here we're going to go to the premolar. Okay, we're ready? 15. We're going to start off with the 15. I'm going to be really careful to manage the gingival tissues very precisely. And we're going to stay with the horizontal incision slightly to the buccal, but still in keratinized tissue. I'm going to maintain the buccal flap also as thick as possible, and going to the incisive area. Okay, first cut. Now we're going to go down to bone. I'm looking for the bone margin on this particular area is quite deficient. So missing most bone on the right side. Okay. Now the palatal elevation. So we're going to go from the premolar, sulcular, and the same on the right side. And on the right side, we're going to go 2 teeth to the side and making my vertical incision through the mucogingival line. Elevating the flap already and the papilla with the scalpel. Okay. Then we're going to go to the right side. Here, because the canine tooth is quite wide, I'll just stick with 1 vertical incision. This is something just personal. I just vary that depending on the site. Always trying to have a leverage. Okay. Ready for the jaw 1. Just going into this one spot again, which was quite deep. Okay, now I can feel the bone a little bit more. Okay. We're switching over to the jaw 1. So this is my instrument that I use to extend the incision, and you can see it with this little chisel-like behavior. I can go through the incision and make sure that I'm really elevating the flap completely. Now careful here. I'm using here a little bit more pressure just so I can get down the bone. Okay, now I'm starting the lateral opening. Let's see how her tissues are. Seems to be that her tissues are moving quite nicely. Sometimes when we have patients like this, due to the previous trauma and the previous surgery, the tissues can be quite scarred, but so far so good. So I'm now using the contralateral aspect of the J1, which is this back section, which helps me to elevate the flap nicely in a full thickness position. I use my special plier, and now we're on bone, and this is going to be tricky because I'm now in an area which is very, very irregular. Okay. Here I'm getting some attachment, so I need a 15 again. Section. Just cutting here in this area, there's like a lot of scar tissue. Okay, I'm getting there. Now let me have this small periosteal elevator. So I'm still working with my J1. Everything is done with a J1 and the scalpel, but now I'm moving to this instrument, which is a very micro elevator, so I can be more on the bone. I have passed that tough area with the scar tissue. Again, here I'm getting a little bit of scar tissue. Full thickness. I'm getting to the first screw. Section. Here again a big defect. So the bone is very, very irregular. Okay, I have exposed the middle screw. I'm seeing here the second screw coming up. The screw, I don't know what it was used for. Maybe it was to stabilize a bone block, but you can see how much resorption there was because most of the screw is exposed and is sitting in soft tissue. Just cutting the fibers around the screw. I believe we have only 2 screws. Okay. So this will be the second and last one. Okay, there we go. Good. So now let's elevate to the left. So the first elevation is almost done. Again, you can see most of the work in the beginning I'm doing with the J1. I have a little bit of bone deficiency here on her canine, probably in the trauma. She lost some bone on the canine, but there's no symptoms on this tooth, no recession and no pathology. There's a big defect. Okay, here you can actually see the remnant of the previous bone block that was used. So I'm going to have to clean that up. We'll show that to you in a second. So this definitely was a previous block graft. Looks to be like a microplate, like something like a Curie technique. And okay. Little soft tissue is invaginated between the microplates, some irrigation. I'm staying full thickness on everything. Okay, now I'm going to go on this side. Again, full thickness. Also, the right premolar is missing bone. Okay. So I will have to elevate this more, but right now you can see already most of the condition we're dealing with. The screws, the 2 bone blocks. Let's open it more. And I'm going to start working on the palatal flap. So I'll start again with an J1 here just to get the first initial elevation. And we're going to get to the incisive canal pretty soon. Okay, here I have some, again, fibers. I have to be very careful. I have to separate them, again, sharp a little bit. The patient has received today as anesthesia local anesthetic, deep infraorbitals and palatos. And we have here an assistance of a medical anesthesiologist who's giving the patient a comfortable intravenous sedation. So she's very, very comfortable at this moment. How is she doing? Like, stable? Yeah. Everything is stable. Okay, ready for the Pritchard. And we can some irrigation. Now I'm switching to the Pritchard. So you can see I've used by now like 3 main instruments. The Joe 1, clean everything, the teeth. You can see the insides of canal. Again, do a large full thickness flap on the palate so that I can place the bone graft and I can place the titanium mesh. I probably will remove the incisive canal. This is going to be helpful to use our literature evidence that we have, which we published about 10 years ago together with Danny Boozer and Istvan Urban. So let me clean the root. I'm just going to clean the root supracrestally. I'm not going to clean the... I use my Joe 1 for this here to make the root surfaces really nice and clean. I don't want any biofilms on the root surface. Okay. Then we have the, we can do the screwdrivers, remove this. We're going to remove the 2 screws. Actually, we're probably going to do a photo on this here, right? Okay, we can do a photo now. We'll take a quick photo on this. Not yet. No. Photo. That's a good visual of what we're dealing with. Suctioning. Okay, good. And buccal. Okay. Using the screwdriver of the Profix system, I have to see if that is going to fit. Normally they're pretty generic, these screws. Yeah, it's fitting. And screws turning. Yeah. See how the screws already turning. Okay. Yeah. Yeah. First screw. Second screw. You can see that even after many months, these screws come out with reverse torque efficiently. So 2 screws are out. And then let's get me ready the piezo. What I'm doing now with the piezo, I'm going to clean up the bone surface. Bone is actually, I was pretty good in elevating the flap in a clean way. You can see that the periosteum has exposed the underlying bone quite nicely. I just want to clean up the area where the bone grafts are. There's probably some. Just put less water. I'm going to put a little bit less water on the piezo. And just right here on the undercut, I'm going to clean any soft tissue. And in between the 2 bone grafts, you can see some soft tissue. So I'm using the piezo surgery Mectron device. Particularly the new device released this year in 2025, I like a lot. So here's some soft tissue, quite a lot of soft tissue around the bone graft. You can see it's very efficient to use the piezo for that. See how the bone graft has an undercut, and in the undercut is a lot of soft tissue. But part of the bone graft is completely fused, so whatever has remained has stayed. I'm going to perforate this a lot, just so I can get maximum vascularization. So this is a really good demonstration of the piezo, because I don't think I could have gotten a good job in cleaning this area. Look, there's like a lot of, look at my piezo is going all the way underneath just to clean that area. Okay, let me see. Just want to see like how much, look, I have an undercut here underneath this bone graft of about 3 millimeters. So that's like no bone contact at all. So I basically have to go in here. Look here. Here also 3 millimeters going underneath this block. So for those of you who are using blocks, you can see what happens afterwards. You see like some bone regeneration, some bone resorption, and then some part doesn't get any integration. Look, I probably could put like something underneath here and just break it off. But I'll leave this in place because I'm going to cover it with autogenous and BMP-2. But I just want to clean this up. The right side has resorbed a lot, so not much is remaining. And whatever is remaining has integrated, and there's no undercuts. So the main problem is the left one. Okay, I need the piezo. And be ready to exchange the gauze again in a moment. Here you can see soft tissue. And obviously for optimal bone regeneration, I can have no, look at that. Yeah, so unless you see the live surgery, you wouldn't really know how much work it is to actually clean a ridge before you do the bone graft, okay? Retract the pelvic flap. Good. Retract the pelvic flap. Yeah. Palatal flap. There's some soft tissue here. Yeah, I think it's good. Let me look at the palate. Plier. Okay, looks very nice and clean. Can you cut this one? Okay, so I'm going to clean a little bit the incisor canal, because there's no fibers there, and I'm going to clean the palatal flap. There's also soft tissue there. Yeah. I'm getting a nice piece of soft tissue here on the palate. I think I'd like some soft tissue here. Yeah, I need the piezo again. Piece of soft tissue that was on the palate. Yep. And right here. Jovan. And a small surgical spoon. You can see how I'm using my back action to remove any of the soft tissue there that has been loosened with the piezo. So as much care as we take of the buccal, we also take care of the palate. Irrigation, some water. Now using a surgical spoon. Okay, piezo. I think we're almost done. John. we're ready now to show. That's about it. We can test the titanium mesh now. So let's show that and a plier. No, don't hold it. Okay, put the titanium, the black there. And here's the titanium mesh. So that's our buccal lingual dimension. Yeah, that's good. That's our buccal lingual dimension. These are our buccal openings for potential screws. Here the occlusal. And there was an opening placed in the top, possibly if needed. And here the palate, you can see how there was a space left on the palate to go around the incisive canal. So let's see how this fits. First view is good. I still have to elevate a little bit more on the. That's good. I can see the buccal bone. Periodontal probe. Okay, that looks good. Elevate the palatal flap. Twitch it here. You can see the buccal bone. There's some soft tissue. I have to remove that. Let's see. Yeah, that sits good. And here I got buccal bone. That's good. Overall, the view is good. Okay. So that's our initial test. Fitting well there. Let's look on the palatal. Retract the palatal flap. Here. Good. On the premolar, we're a little bit close towards the root, but it's more on the apical extent. So ideally, maybe could have taken this off less, but it's going to be pretty deep on the buccal. Also a little bit. If there would be bone in the root, there would be no problem. So, but this is good. It fits really beautiful. Okay, so we're good with that. We can remove that. So a titanium mesh, overall I would say like about 90% perfect, with maybe just, I would design it next time a little bit shorter here and a little bit shorter here. But it's deep in the tissue, so I don't think this will be giving us any troubles. Okay, so let's take a photo of that ridge there, and then we're ready to perforate. We can start preparing the BMP-2. Okay, just irrigation, suction. Okay. Okay, if you want to show the mirror. Very, very, extremely narrow ridge. Okay. Oh, there we go. Nice. You see the incisive canal right there? And here, very, very narrow ridge. But you can see also very clean. Okay? Well, she has from the first step. Okay. So next thing, we will start preparing the BMP-2, and I'll start working on the lower right area to get some autogenous bone. So I can give her some anesthetic there, and we're going to reposition the camera a little bit. suction there. I need suction. Okay, whatever. Use it. Suction.
Suction Bella.
No, you cannot. No.
This has to be inside and the tongue outside. Okay, I have to go there.
There's some more anesthetic. And the gauze is in the way. Okay, I need a new needle. And we can start the safe scraper. Safe scraper. Okay, patient is like getting better. Okay, section here. Okay, so here's my safe scraper. We drop a little bit of water into it. Can you hold her? Good job, good job. Okay, let's put the bone. I'm going to carry the first bone into the dappen dish. Okay. Give me a little bit more water in here. I'm going to go for the second pass. Give me a Pritchard, please, or like a, yeah. Like that, or like a. Suction that. Mm-hmm. Okay, second pass. Okay, we need to prepare the autogenous, the BMP.
Two already?
Hmm? No, I can finish the ramus. Let's do the, because right now we showed the ramus as much as we can. It's not a good visual anyway. So let's show the BMP-2, the preparation, and I'll continue. I'll basically work here in the posterior ramus more to get some more autogenous. And we purchased 3 layers of 0.7 cc BMP-2. We prepared already 2, so 1.4 is already prepared. And right now we're going to prepare 1 more. And I need a resorbable suture, large needle. Yeah, you have a, that's good, yeah, that's good. The third pass of autogenous, we're actually really doing really good. Let's go 1 more pass and then we're done. We're preparing already the BMP-2. I took 4 passes of autogenous and with about half a cc of xenograft on the BMP-2. We're going to have plenty of bone. So I'm going to irrigate the lower right. You irrigate the lower right? I'll be right back. Okay, we're going to just show you the BMP-2. Irrigate a little bit lower right, okay. Okay, good. Perforations. Retract here. Retract. So we'll go through the cortical plates that were used to activate that. And into like the residual bone. Is there enough water? There's no water. Retract. Retract. Here's some irrigation. Just a little bit. On the burr, just on the burr. This is the block which had a lot of soft tissue. So I'm going to go all the way through. I'm going through the block and into the residual bone. Because the goal will be is that the bone graft will completely incorporate this here. Okay. That's good. A little bit of palatal. Plier with teeth. on the breath. Okay. Fix this here. Okay, we're good here. A little bit of elevation I need on the left side. We're getting almost ready to place the bone graft. We'll need the xenograft prepared, half a cc or half a gram. So that looks good. And yes, we're going to get ready to release the flap. So I just want to make sure that I'm fully, you can see here the nasal floor right there. There's the nasal floor, yep. And I have sufficient release. I'm all the way below the gingival margin. So okay, so I'm ready for the new 15. Is this a new one? New, I need a new. Wait, which one is the new one? No, I want to see it. Put it in a second daffin dish so we can show it. Okay, so now we'll show you the release. So I'm stretching out the flap first, and I go from the left vertical. I am below the vestibulum, so I make sure that my cut is below the vestibulum. Good scar tissue here. Continuing the same. Okay, so my first initial cut has been completed from the right side. Now I'm brushing and opening up the cut more. We're brushing, coroning. I'm using the same blade, but I'm not brushing more, not cutting more, brushing. See that here? Good. So now pick up the periosteum. You hold this one. Hold this. This corner here. This corner. Take this corner. Now I'm taking the internal part. See, the bleeding is relatively minimal. Which one? suction it. Okay, let's see. It's really almost perfect. You can see how I can move the flap all the way palatal, so no tension. Okay, retract one more time. I'll try to make like a little partial internal.
Hands in a frame.
So you can see my internal flap that I can move coronally, and I can even it's a little bit still tight here. I can move this, retract this outer flap. Okay. Yeah. So this is my internal flap. I can move this later on over the mesh, which is good. So we have a 2-layer closure. Just need a little bit more release on this side. Hold this one. Mm-hmm.
Hands in a frame.
This is called the Triaca split. That should be enough. Okay. The last check. You can see here how I can move the flap with no tension in position. Okay, so we're good. We're ready to show we made the perforations already. We released the flap. We now can do the titanium mesh and the bone graft. So you can see here the amount of bone we have. So I have on the in my right hand or left side of the screen, I have the xenograft, 1/2 gram of Bio-Oss xenograft, and then on the left side, I have the autogenous. So it's about double. So I would say 1 gram of 2/3 is autogenous, 1/3 is xenograft. I'm going to mix those two, and I need the BMP-2 now. Okay, you can cut that into small pieces. So let's see. Let me just show. We'll show the BMP-2 here. So here's the BMP-2. This is 0.7 cc, and we're going to cut it in small pieces, and then we're going to mix it into the autogenous. Mm-hmm. So we'll mix this. Bring this first. You hold this one here, these two. Show this in the camera here. Mm-hmm. 1 second. Okay, here's the two.
Zoom up.
Yeah. Okay, so half a gram is added, and we're making the mix. That's my first mix. And then we're going to start adding the BMP-2. So it looks like we're going to have a really, really good mix here today. Okay. That's 0.7, right?
Yeah.
Okay.
You want
later. Okay, take the next one. Okay, just put gauze there. Okay. Okay. Hold this. Here's the cut BMP-2. Okay, so I'm going to mix that into the graft. Leave that one. Leave that one. I'm going to put one at the bottom. So maybe cut it here. Here at this level. Okay. And I have the second 0.7 cc. And I'm mixing a little bit smaller. Make it a little smaller. Okay. You can see now the collagen sponges, which have been pre-measured, so we know exactly how much of the BMP-2 growth factor there will be. And so I think this is the most maximum potential of patient's own growth factors from the autogenous source, from the ramus, then the BMP-2. It's good. Okay, small one here. Then I'm ready to do the titanium mesh. And the plier. Okay. So here's the titanium mesh. And I'm going to place one layer of BMP-2 just at the bottom. You'll be directly facing the titanium. There's also a great effect. And then we're ready for the bone graft. Bone graft. You can push it in. Okay, that should be enough. Okay. Let's take one photo of this. Come here. Okay, we have some extra bone left, so we might use that kind in the overlap, but don't have too much bone left. So this is what I have left. I can use that maybe in the voids. Once I place the mesh, I can use that in the voids. No flash. Okay, I'm going to start placing the BMP-2 autogenous xenograft mixture. Retract. And here we go. That's moving in pretty nicely, no problem. Yeah. And here in this area I actually have a void on the buccal, so I will push some of the bone in this area here. So the extra bone I can use. Okay, I'm ready for the first fixation screw on the straight handpiece. And I'm just making sure that I'm in the right position. But that looks good. You can see the BMP-2 right underneath the mesh. That's great too. Okay. I can use either a 3mm screw or a 5mm screw. So I think I'm pretty directly on bone. Just depends on how close the mesh is on the bone. Here I'm directly on bone, so I can place a 3. This is the Profix. Go move over here, other way, yeah, perfect. Okay, there we go. The Profix screw grabs the underlying bone right away, so that's good. Good, second one. First one is very stable. Can I go this way? Okay, and let's do one more here. Give me one more. We'll do 3. So we have a 3 stability.
Can I move him?
Mm-hmm. Okay. Let's see, stable. Good, not moving, not rocking. Very stable. Okay, let me have the rest of the bone so I can push it underneath the little gap here. This, yeah, smaller. Okay. What's the shortest 10 screw you have? What's the shortest? And you have the, just looking for one more screw. You have no 5? I'm going to switch to like a 5mm screw because I feel that the left one is a little bit loose. So give me a 5mm screw. Here. And the void is already filled up. I don't think they need more there. No. Okay, that's a 5mm screw right now I'm switching to. And holding the titanium mesh in place. And this is working out great. So 2 3mm screws on the left and 1 5mm on the right. Okay, do a photo and we're ready to close. I need like a 25 by 25 bar guide. So you can see no movement. We got great contour. The width is like about 9. Actually, yeah, 9 to 10 millimeters. Here's the BMP-2 collagen right underneath, so that's good too. And palatal. Good, okay? Got it. No flowers? Okay, good. And buckle, yeah. I'll adjust right away. Okay, we can go with the BMP-2. Sorry, sorry. With the BioGuide. This is basically just to give us an exclusion of the soft tissue invasion at the beginning, because obviously you have this large big groove at the top, and then you have the microperforations. You have a little bit of drops of water, saline. Here's the net. No, let's leave it here. Okay. Here comes the membrane. I'm ready for like a suture. 3 out. A little bit too long on the palate. The collagen on the natural collagen membrane extends quite a bit, so it widens out to about 40 to 60%. Okay, my main goal is to cover the microperforations and the big horizontal groove. Okay, so that's it. Not too worried about the side. The occlusal is completely covered. And most of the microperforations are covered. Okay, that's good. And take one photo. And we're taking the suture. And I'll see if I can do an internal closure. Yeah, I should be able. Okay. Probably occlusal is the best, huh? Yeah, yeah. Just one quick occlusal photo. Okay. Yeah, 1 second. Okay. Palatal flap, retract the palatal flap. Okay, there's your occlusal photo. Nice width, controlled for it. So like space is completely controlled right now. Okay. Ready? Retract. We're going to start the suture. We'll start a deep suture from the palate. We need a second suture. Retract, retract. Retract. Okay, now we close the internal flap. You can see how I'm already moving the internal flap over the titanium mesh. I make 4 knots. Okay. Need a plier. Here's the internal layer. Don't pull too hard. And here's the first layer. So 2 mattresses and the third one. And then the healing time here will be as in normal vertical and horizontal will be 9 months. Small Pritchett. Going directly to the palate. And the mirror. Show the 3 mattress. Yeah. And you can see that in the mirror shot, you can see the internal part of the flap, how it has been moved as a internal layer over the titanium mesh. It's mainly over the buccal, partially on the occlusal, nothing on the palate. If I would have released it more, I could have completely moved this to the palate, but I stopped as we had so much release already. Okay. Next suture, we're going to close the crest now. Okay. I'm going to start in the middle. You see, completely loose. Okay, comes my first closure. Look, no tension at all, just already moves nicely together. And eversion. critical always in these severe, complex reconstructions to have this primary closure. Four knots. Mm-hmm. She's shaking now.
Doctor, she's shaking.
Okay, let's show the mirror shot. This is really getting pretty nicely closed. Mirror shot. We're almost finished.
Is the gauze soaked?
No. A little bit doesn't smell, but it's not blood anyway. No, I'm gonna put this
Okay.
in here. Open.
She's so locked. You can't move the jaw.
Okay.
Do you have a bite marker?
Yeah.
Yeah, but she's biting through it. It's like,
This time it should be on.
can you try like give me the other bite blocks? Or like no.
No, it would not. Even
No?
if it's, no. Because I just need to remove
Okay.
that.
I need the plier. We'll put one more mattress, and that'll be our final on the right side. And the cresta incision will be completely sealed. Ooh. Okay, ready with the single interrupted. We need one more suture. This is single interrupted, moving on the mesial of the canine. Okay, cut. Okay, let's go in the verticals. On this one first. Closing the vertical on the distal. Small plier. Plier. The other one. With the papilla, I'm going to go to the palate. Then take the palatal flap, which I've released. So I'll secure the papilla with the palate. and then come back and do a small sling suture. Okay, cut. Okay, I'm going to go take this one away. I'm going to go to this side. And now we close the left side. I have 2 teeth there. So I'll go first to the apical part so I can reposition. A bit more to this side. Can you come? Mhm. Here's 15C. Going to reposition a little bit. The tissues are too far coronal. I'm just going to reposition this a little bit. And a single interrupted deep on the mesial of the premolars to get the papilla really to position nicely. Mm-hmm. Okay, one more suture. That'll be our last one. So a couple of last sutures. Again, I have to go to the sling from the buccal. Okay, I took the palate flap, took the papilla. Yeah, cut. Last one for the last papilla. It wasn't easy, as expected, complex case, but everything went really well. We're struggling a little bit today with the patient management, just with the throat pack. For the rest, everything went really well. And of course, always the time to clean everything and the time to suture. Wet gauze, irrigation, and mirror shot. Make it wet. So this is all dry. I need. Okay. Take this. Mirror shot. Okay, there's your mirror shot. Okay, we can take a final photo. And I'm looking at the mirror really carefully that I can see that there's absolutely everything is really sealed. That looks really, really good. Okay. So we are good here. We're going to take final photos and we're going to take an exit interview. So we finished approximately 2 hours of the procedure with probably some extra minutes for the different things that we were encountering, patient management, and some small details, so probably like an hour and 45 minutes. And everything went really well. So the autogenous harvest on the lower right gave me a lot of autogenous bone, so that was great. The BMP-2 was also sufficient, so the ridge actually, we had plenty of bone harvest. The titanium mesh fit really well. I mentioned two parts of the lateral apical area. It could have been a little bit more narrow, but I don't think this is an issue. It's a learning aspect. The incision laid well. The elevation was tough because of all these bone grafts and screws who were there, so that was a little bit tricky. The cleaning was also tricky underneath the bone. That was good to see. And then one little tricky thing with the 3mm screw, we had to use a 5mm screw on the left one. And then the closure was interesting because I made that Triaca periosteal release internal. So I made an initial closure. So basically I did today a 2-layer flap closure. And then of course the superficial, or the top layer with the mattress and a single interrupted. So now we're going to wait for 2 weeks, 2 to 3 weeks to remove the sutures. And then the patient will have to wait for about 9 months before we get this ridge completely back to normal. And obviously, we are protecting the patient from any kind of trauma, so there's no pressure on the site. So over and out, and thank you.